Save us, dear vaccine. Take us seriously. We had plans. We were going places. Children in kindergarten. So many voices in chorus. Give us our world again. Tiny gleaming vials. Enter our cities and towns, shining your light. Restore us to each other. We liked our lives. Maybe we didn't thank them enough. Being able to cross streets with people we didn't know. Pressing elevator buttons, smiling at strangers, standing in line to pay. We liked standing in line more than we pretended. It's a quick prick in the arm. You'll barely notice it. It's the gas in the car getting us going again. It's the turn in the road, face-to-face conversation someday soon. It's the hug. Forever. It's the hug. Vaccine, please make the air clean. We went to yoga classes, deep collective breathing, in small rooms in cities where we didn't even live. How brave we were. Vaccine, please restore our lives. Believe they were beautiful. This is the global vaccine poem, Dear Vaccine, by Naomi Shahabnai. Today, I have an update for everyone that's pretty exciting about the vaccines. So, stay tuned if you're into that. And before we get started, please do make sure that you hit the subscribe button. Please make sure that you put your notifications to all, like the video, share it around so that we can promote everyone getting vaccinated so that we can get back onto our lives just like the poem said. From the Toronto Star, Ontario expands COVID-19 booster shots to 2.75 million residents. Good news for Ontario. It's booster time for almost 3 million Ontarians at higher risk for COVID-19 infection as the province moves closer to third shots for everyone next year. Anyone 70 or older and all those who got 2 doses of AstraZeneca qualify for third vaccine shots once they are at least 6 months past their second dose, the provincial government said Wednesday. Also on the list are frontline healthcare workers, designated essential caregivers for loved ones in nursing homes or other congregate settings, along with First Nations, Inuit, and Métis adults, and any members of their households. Boosters will be with the Pfizer or Moderna mRNA vaccines, which are considered more effective than AstraZeneca or its equivalent, Covishield. This virus is not going away, Ontario's Chief Medical Officer Dr. Kieran Moore told a news conference at the legislature, noting booster shots will not be required for the vaccine passport system. For some groups, 2 doses may not be enough to achieve a high level of protection, or immunity can decrease gradually over time, leaving them at higher risk for serious outcomes. Bookings begin Saturday morning at 8 a.m. through the provincial appointment system, public health units, select pharmacies, and through hospitals. Would you get a COVID-19 booster shot given the chance? Yes! Woohoo! Go Ontario, go! Dr. Isaac Bogosh, an infectious disease specialist and a former member of the government's disbanded vaccination task force, called the plan pretty reasonable. So if you are one of the almost 3 million Ontarians that need a booster shot, please do go and get your booster shots. That would be the first group of people that got their vaccines. The other good news that we have is that Ottawa Public Health outlines plan to vaccinate kids as young as 5, something I am very excited for. I do have a 7-year-old, and it has been very scary going back to school for the little ones, not having a vaccine yet for those that are under 12, so I am excited about this. So about 70,000 kids will soon be eligible for the COVID-19 vaccine, Public Health expects. As Pfizer awaits Health Canada's approval of its COVID-19 vaccine for kids 5 to 11 years old, Ottawa Public Health says it will be able to vaccinate all children in that age group within 4 weeks of being given the green light. Good news. OPH said it anticipates roughly 70,000 children will become eligible for that vaccine within the coming weeks. During a broad meeting Monday evening, Medical Officer of Health Dr. Vera Etches said there should be enough supply for a rapid push to vaccinate that entire age group. She said the goal is to vaccinate 90% of that population. The outbreaks that we're detecting are mostly detected in schools, which is one of the big fears that parents have right now. Etches said, specifying that nearly half of the city's current positive cases are school-aged children. Parents will be able to book appointments through the provincial booking system. OPH staff said it is working with the Ontario government to make the site more user-friendly and to allow families with multiple children to book appointments together. That just makes things easier for everyone. Vaccine clinics will be available at schools, throughout the community, and at pharmacies. The plan is also to operate those clinics on extended hours to accommodate families. OPH said it has a number of experienced nurses and numbing spray to help children who may be fearful of needles. So again, that's some good news. I know my kid's gonna need that. Addressing the COVID-19 vaccine hesitancy. Alrighty. So any move to mandate COVID-19 vaccines in school would be up to the province, according to Etches. But she said she's optimistic most families will voluntarily get their children vaccinated. It is true most children will not experience severe outcomes from COVID-19 infection, but some will. And vaccination decreases the risk of severe outcomes, Etches said. When children are less likely to transmit COVID-19 because they are immunized, they're helped indirectly by the benefits that come from keeping COVID-19 manageable in the community. Etches said immunizing kids will help keep schools open by reducing the risk of transmission and, by extension, allow parents to continue working and kids to keep participating in extracurricular activities. OPH said it will roll out material in schools and host town halls to answer parents' questions. So again, if you do have any questions or any type of vaccine hesitancy whatsoever, please do show up to the town halls and ask the appropriate questions that you want answered. They will be happy to answer them all for you so that you do feel more comfortable about children getting the vaccine. The other good thing about the vaccine that they said is that if your child is vaccinated and they contract COVID, they will not need to isolate at home for 10 days and stay out of school. It won't have to be as long. They will be able to get better and get back to school quicker, which means a better education for your child. So please do get your children vaccinated as soon as possible. The green light should be given. Hopefully, they're saying within the next few weeks. And then again, within 4 weeks after that, we should all be able to make appointments for our kids. We're hoping by Christmas break. So if you do need a booster shot, please be sure to go and get the booster shot. They will be taking appointments in a couple days. Make sure that you call them over this next week and make your appointment so you can get in early. Also, children should be getting vaccinated hopefully by Christmas break. We should hear, keeping our fingers crossed. And please do give this video a like, subscribe if you are new here. Every little bit helps me out. Please think of joining the channel to help me make amazing content like this where we promote people get vaccinated. And again, share this video out to help let everyone know that the time has come for us in Ontario, and hopefully it will come for everyone else as well. No matter where you are, what you're doing, I hope that you have a fabulous, fabulous day. Take care, and I will see you in the next one. I will be doing a live stream over the next couple days, and then I have a Mary Kay deep dive and my Jonestown video coming out next week. So make sure you hit that subscribe button and that notification bell so you don't miss out. Bye!